Hi guys, welcome back to my channel. In this video today I will discuss about NHS job interviews, about my experience of recent NHS job interviews, how I did with them, what are the parts of the interview, what are the main questions they can ask for the middle grade job or a junior level job, what are the requirement and eligibility criteria, and what are the main websites you need to apply for the jobs. Regarding the jobs, how you need to apply, I will make a separate video, but in this I will share the important tips and tricks of cracking the NHS interview. First of all, the components of NHS interview. It usually consists of three components. The first part is your basic intro, in which they will ask you, take us through your CV, tell me about yourself, or how does a typical day look like. These are the three main questions they are going to ask you. Second section is about the clinical scenario. They may ask you 2 or 3 clinical scenarios, sometimes they may ask more than this. And third part is about the ethical scenario, which is the communication part. I will tell more details in further few minutes, but before that I want to tell you guys that usually the interview takes place remotely. They are going to send a video link for the Teams meeting, so make sure that your connection is okay. You have already installed the Teams meeting app in your laptop or in your mobile. Like if you are traveling and you are unable to have access to your laptop, then you can even attend the interview on your MS Teams app by the mobile as well. There is no problem at all. Many people have done interview on Teams meeting without any issue. So you can use either laptop or the mobile, but laptop seems more professional. If you have access, then it's more easy. And some of the interviewers, they ask you to keep your identity ready. Some of them only ask. So in that case, you need to keep your driving license near you or your passport, so that they are going to confirm your identity before starting your interview. And before your interview, make a trial by just sending a link to your partner or your study partner or your friend, so that you can make sure that your connection is working well and you have good access to the MS Teams, in order to avoid any kind of problems on the day of interview. So be ready before time. And now let's move to the parts of interview. So as I mentioned earlier, the first part of the interview is take us through your CV. Tell us about yourself. Some of the interviewers, they may ask you, tell us about your achievement after your academic part. Then you need to take them through your clinical part only. If you have anything extraordinary in your academic part, just give it a glimpse, like, okay, I have been a gold medalist during my academic years, I got this much gold medal. Just mention this and then go ahead. But usually start by your intro, like, I am Dr. this, I have this qualification, I have this much years of clinical experience, my clinical experience starts by this. This is in case they ask you about the clinical only. But if they ask about the academic as well, then you need to mention that from where you graduated, from where you did your matriculation exam, and from where you just did your intermediate, and what were the important points or important significant accomplishments that you have achieved during your graduation. You were a part of sports team, magazine, or any extracurricular activities. You should highlight that to them. Then go to your internship, and after that mention if you have good clinical experience, then mention that in detail. But if you have only few years of clinical experience, in that case, give a detail about your internship, that you did internship in your medicine and surgical part. Medicine was subdivided into general medicine and the cardiology, like this. So you can, if less years of experience, then give detail, so that at least take 2 to 3 minutes in your basic intro, the first questions. This is the most important question. They are going to make the impression about you, that what kind of personality you have, how you can present yourself. Just remember, guys, you're going to achieve a big goal. You're going to apply for the NHS job, so you have to present to them that you are presentable, you are good enough to be hired for their institute. So make it well crisp. And I would suggest before interview, first practice it with yourself. Write it down on the notebook in the form of notes, and then read it in front of the mirror. Practice it at least 4 to 5 times so that it should be fluent. You should not have any kind of hesitation during your interview. You should be presentable, you should be confident enough, and make sure that you are well dressed as well. Okay, so going ahead, regarding your clinical part, you should mention typically what does a typical day look like. That your day starts with morning meeting, then you go for rounds, then you make discharge, then you make OPD. Like whatever you are doing in a typical day, you should mention to them regarding your typical duties that you are going to perform, which you have already mentioned in your job description in your CV. Don't forget, whatever you have mentioned in the CV, it should be honest, because they may ask anything regarding the CV. So be sure that whatever you have mentioned, you are going to mention in your interview as well. So about the typical day, you should tell them about the typical day of your latest job, but take them through all your experiences in chronological order. Don't jump here and there, like this job was like this and that was like this. No, go from the year after your internship. What was your first job? How many years you worked with them? Was it a tertiary care or primary care? Then what was your second job? How many years you worked with them? And what is your current job? How many years you are working with them? And then mention to them about your current job experience. What does a typical day look like? What are your main job responsibilities? And in this portion, also highlight your particular skills that you have, procedural skills. If you can insert a chest drain, don't consider anything minor. Everything is very important. If you can insert, if you are very good at cannulation, then highlight it, that I am very good at cannulation. I can perform the lumbar puncture independently. I can insert the chest tube. I can do the Ryle tube insertion, catheterization. So mention each and everything, abdominal paracentesis. Whatever skills you have learned, you need to sell them out now in your interview. Impress them by your skills. You are very good at resuscitation as well. You have already passed SCLS and BLS exams. Okay, you are certified. If you have attained any trainings, any additional diplomas, then you can mention them as well. And specifically, if you have passed any exam, like okay, if you are going on the basis of plebe and for a junior level job, okay, you can mention about plebe. But if you are going for a middle grade jobs or a senior level job, first highlight to them that you have passed all the parts of your membership exams of Royal Colleges. You have cleared all the 3 parts, and you have full GMC in hand. You have finished your OIT. Okay, so this is all about your introduction. Next question is clinical scenario. Usually there are 2 interviewers. They are the consultants. One of them is the lead consultant and the other one is the assistant. And sometimes there could be an HR candidate as well who is accompanying them. So the lead consultant is the one usually asking the questions, and the other one may ask question, or he is just the observer. And regarding the clinical scenario, it depends upon which position you are applying. If you are applying for the junior grade job, position, then I would suggest whatever position you are applying, because you are applying for NHS job, for job in UK. So you should have good information about what role you are going to play in this trust. What is a typical duty description of a person with the same job in UK? Most importantly, for this part, you should go through the job description, your main responsibilities that the trust have provided you, because usually when you are applying for the jobs on the track jobs or wherever, or through the agent, which I have mentioned in another video, make sure that you read your job description very well, because those are the things they expect you to know. You should know what is the role of the SHO in NHS. If you have any friend or colleague working in NHS already with similar position, like if you are giving interview for medical position or surgical position, you should talk to someone ahead of your interview that what does you do at your duty on a typical day. like what are the job responsibilities of SHO in NHS, because the one who are working in Middle East or Asia, they have different job responsibilities than the one in NHS. So if you are very well enough aware of the job responsibilities of SHO, and you tell them that you have this, then you would be in better position to secure an interview and to pass an interview. Similarly, if you are applying for a red job or middle grade job, talk to your colleague who are already working in similar position. Talk to them in detail what duties you are performing, so that you are able to give them the answers accordingly. Like, they are the one taking the main decisions. Who is the one taking decision? When to escalate, when to discharge the patient, these decision who is taking. So you should be well aware. In that case only you can secure a job and you can impress the consultants. Okay, so regarding the clinical scenarios, what type of clinical scenarios they can ask? Because I am from a medical specialty, so I will just tell about the medical specialty and how you can prepare for that. So for me, I have prepared from the Oxford Handbook of Clinical Medicine or Acute Medicine, the acute emergencies. Always read the acute emergencies, because if you are applying for a middle grade job, which I was applying, they expect us to manage all the acute emergencies: when to discharge the patient, when to escalate the patient, how to manage the patient, how to take opinion from the senior, when to take opinion. Because middle grade job is usually independent, they expect us to take most of the decision on our own. So we should be confident enough to know all the things in detail. So never forget to read this portion of emergencies in Oxford Handbook of Clinical Medicine. Other than that, if you are applying for a specialty registrar or any particular specialty, so always read about the main emergency topics of that specialty as well. Like if you are applying for endocrinology, they you may be expected to ask about DKA, Addisonian crisis, thyroid storm. So never forget, emergencies are emergencies, and you are the doctor who is on duty, and you need to manage the emergencies. This is what they expect us is a reg level. Okay, so regarding the specialty, whatever specialty you are applying, read the main topics, and also never forget the acute medical emergencies, because even if you are applying for a specialty, you are expected to perform the on-call duties as a medical reg. So as a medical reg, you should know the main medical emergencies like acute coronary syndrome, COPD exacerbation, acute stroke, SCS, like this. So do read about them and have good knowledge about that as well. And the main topics which I have been asked, I will just give a highlight. One of the topic was about DKA, and they will give you a scenario that the patient presented with this, and what are the initial, how you are going to assess the patient. Never forget ABCD assessment. Always mention in all the scenarios, you will first do the ABCD assessment, then you will look at the vitals of the patient, manage accordingly whatever initial investigations you are going to do, you are going to resuscitate, whatever. Okay, and always look at the pre-morbid state of the patient, because they can give you a scenario like the MRCP exam, like a proper scenario, written scenario, and they will ask you how you are going to approach this case. In that case, you need to initially make the respect form. You need to know that if the patient is well enough, that I need to go for aggressive resuscitation and these things. Okay, always look at the pre-morbid state, when you need to perform the resuscitation, when you need to make the decision of do not attempt resuscitation. This is usually the registrar duty in UK. So you should have enough knowledge and enough data that when you are going to make this decision, it's upon the registrar. Okay, other questions they might ask you regarding the chest pain, what are the differential diagnoses, how you are going to approach, like acute coronary syndrome and tension pneumothorax, pulmonary embolism. And then the sepsis patient can be given to you, like it could be urosepsis, it could be pneumonia, it could be any sepsis. You should know the sepsis 6 bundle and how you are going to approach a patient of sepsis. Other than that, COPD exacerbation, this is one of the typical scenario they can ask. And these are the main scenarios that can be. Upper GI bleed, if you are appearing for gastro, then upper GI bleed, acute paracetamol poisoning, acute liver failure, and pulmonary embolism. These are a very important topic if you are appearing for medical registrar position. Also the acute exacerbation of asthma and status epilepticus, all the emergencies. You should know in detail how you're going to approach, and also read the ALS protocol, which is given in the same Oxford Handbook of Clinical Medicine. If you have already done the ALS and BLS, then it is a very good point, and it is a very good addition to the CV. If you have not done yet, do it before you appear for interview, so that you should have enough knowledge, because it is one of the fascinating point for the interviewers to select you for the interview. Because I have already done them, so I mentioned that in the CV, and most of the interviewers, they ask me, do you have ALS already? And in registrar level, they expect us to lead the team of ALS. So once they ask me about this scenario as well, that if you are a medical registrar on duty and you are the one team leader, how you are going to manage. So you should know what role you are going to do. In that case, you need to ask about the one of your colleague who is already working in NHS. They can guide better about this. So this is all about clinical. They can ask you directly, they can ask you in the written form, and as I mentioned, one will be the lead consultant, other will be observing as well, and the other can ask any scenario of differential in between as well. The last part is about the ethical scenario. In ethical scenario, they can ask you anything that you have prepared for your PLAB or MRCP exam. Like they will ask you what is the duty of candor when you are going to take the decision of DNAR. They can put you in a clinical situation like you are in real exam. They will ask you this patient presented to you. He is already diabetic, hypertensive, he's pre-morbid, he was bedridden, he was having stroke. So how you are going to deal with this patient? So they expect you, if a patient has bad pre-morbid condition already, the pre-morbid status of the patient is not good enough to be a candidate for resuscitation. They expect us to make the decision of DNAR, do not attempt resuscitation. So you should have this instinct that when you are going to take this decision. Okay. And other than this, other clinical scenario, they may ask you, which they ask me, that if I am with a patient and the patient, if I went to see a patient without accompanying anyone, like usually in NHS, even everywhere it's the rule, if you're going to examine a male patient, you should accompany someone with you, always a chaperone or any nurse or anyone. And if you are vice versa for the female patient as well. So if a patient blamed that he put an allegation that this doctor touched me inappropriately, then in that case, what you are going to do? So in that case, of course, we need to inform our supervisor that nothing like this happened. Then they expect you what you are going to do. Like always, as we study in communication station, that we need to admit, accept, and take action. Apologize also, take action. So what action we are going to take? We are going to take the action that next time, whenever we are visiting any patient, we should accompany with someone. We should be accompanied. So that is the action. Always tell the action. What is the problem? What is the solution? They expect us to give them the solution. Okay, mistakes, no one is perfect. Mistakes can happen, but regarding any medical error also, they expect us like the duty of candor, admit, apologize, action. So they expect us what we are going to do for the future. So this is always important. If we make a medical error, okay, we should, this is a medical error, we should accept it and we should apologize for that and we should take action for that as well. So these kind of communication scenarios, usually they expect us to know them very well. Ethical scenario, all of them which are mentioned in the MRCP exam, about like, okay, if a patient is being brought by the family and they don't want the patient to be escalated, what you are going to do, and the patient is unconscious. So in that case, of course, the same decision like MRCP. Do they have any advance directive, any lasting power of attorney, anything? If not, then we need to go for the best interest of the patient. So these are the important tips and tricks we need to know regarding interview. And then the last question will be, do you have any question for them? Please remember, never ask about salary. It's not a professional question to be asked. Ask about how you are going to support me regarding my training, regarding the Caesar training, regarding my professional achievements, how the trust is going to support me for research. So any question, prepare very well before the interview. So make yourself well prepared before appearing for the interview. Don't look like you are okay, this is the first time you are sitting for interview and you have not prepared well enough. Go well enough. Practice with colleagues, practice in front of mirror. If you don't have anyone, practice in front of mirror. Stay confident, stay calm, dress professionally. These are the keys to rock. And the most important thing, apply as many jobs as you can, give as many interviews as you can. I will not suggest, okay, if you are a medical person and you got a job interview for acute medicine or you applied for acute medicine, so you don't want to sit for that, sit for the interview. Be confident, at least learn the way how they are going to conduct the interview, what you are expected to do in interview, because this is the only key that will help you face the fear of interview. Even if you fail the first interview, it's very normal. You are not a perfect guy, you are not a perfect girl who is going to rock all the times. The first time is always getting accustomed to the interview. So present yourself, know the techniques. Whatever I am telling, it is going to help you, but unless you were going to appear, you will only learn the best things by yourself once you will appear the interview. A real scenario is different than what is told. Most of the interviews are in the same scheme, but you will only get used to it once you will sit in front of the camera, in front of the consultant, once you will get answer their questions. Okay, so again, stay confident, stay calm, and prepare enough for the interview, and always prepare a question at the end of the interview to be asked from them. And yeah, usually they get back to you within one to 2 days about the outcome of your interview. Some of the consultants, they even give you a detailed feedback that what was the shortcoming in your interview, what you need to improve, and some of them may delay it for a week duration. So stay hopeful, stay positive, and all the best. Thank you so much. If you like my video, don't forget to comment, subscribe, and share my channel. Thank you. See you soon again with next exciting video.